Hi, my name is Rebecca Lucero, and I will be giving you the lecture on the Self of the Family Therapist. You should have read the chapter in the book that kind of explains some of these concepts, and we'll also discuss some additional issues concerning Self of the Family Therapist. So first I want to talk about how the therapist is important. In the book, we read that the most significant aspect that you bring to therapy is you. And this is something that I found to be really true in my work. You can only take others as far as you are willing to go yourself. You're really an important part of what is going to be therapeutic. Oftentimes, you may be the only person that this person has been able to trust. They will open up and share things with you. And so how healthy you are and what you're doing personally and professionally influences what goes on in therapy. And so it's important to kind of think about it, right? If maybe some of you are familiar with the airplane and how they talk about how you need to put on your oxygen mask first before putting it on someone else. It's important that you be dealing with the dysfunction or the problems in your own life before you can really help someone else. And that doesn't mean that by any means that you have to be perfect, right? But to think that you could ignore your own problems, or just to think that you don't need to be as healthy as your clients, right? You're doing a disservice to yourself and also to your clients, because you can't really teach somebody something that you don't know. So we have this like little cartoon where the client is saying, "I just don't believe in myself," and then we have the therapist saying, "That makes two of us," right? I think you can imagine that if you were the client in that situation, that wouldn't bring you much comfort. So some common factors of therapy. One of the biggest factors is client extra therapeutic factors. So these are factors of maturing, aging, something outside of therapy changing. So it has something, means something in their life changes that has nothing to do with what's actually going on in therapy. So basically, right, we're saying that a lot of times maybe things just get better on their own, right? 40% is maybe you moved, maybe you switched a job, things like that, that may not be particularly related to therapy. 30% is due to the therapeutic relationship. So this means the relationship between you as a therapist and the client. This is huge, right? This is a third of the change, right? Is whether or not this person feels like they have a strong bond with you, right? Do they listen to you? Do they respect you? Do they feel like you care about them? And so right there is 30% that you directly affect. The other 15% is hope and expectancy, right? Does this person actually believe that things can get better, that therapy will be helpful? And you can also probably influence some of that. And then the other 15% is model factors. And by model factors, we mean that usually when you're giving someone therapy, you're operating from some kind of therapeutic model. And when that's a good fit for you, that results in better effectiveness of therapy. And so the better trained you are in the model that you're using, you can use that more effectively with the client. So I also want to discuss therapist beliefs. Some of you might be in this class because you want to be a therapist or counselor. Others of you might be taking this for more personal reasons. But either way, this could be important for you to think about your beliefs about people in general and how change occurs. So a lot of times when we are talking about this among therapists, right, some kind of operate from this strengths base, right, that they believe that people are basically good and are always doing the best they can, right? This is a belief about human nature. Other people might believe in more of a deficiency-based human nature where people have ill motives and need to be taught to be good, right? To choose good versus, malicious behavior. So be thoughtful about, do you assume that people are good and doing the best they can, or do you think it's important that we teach people? Because that will influence how you interact with your clients. Also thinking about the role of the therapist. So some people like to think of the therapist as the expert, someone who comes in, identifies problems, identifies solutions, and kind of helps that person work through it because they're an expert. Other people have identified it as a one down. So sometimes therapeutic models will focus on being client-led. And what that means is that the client may direct what's talked about. The client, it may focus on the client's language, using the same language as the client uses. It can also focus on letting the client identify the problem. So sometimes somebody might come in and you might see that they're arguing, right? And they may say, the real problem is this. And so goals will center around whatever they say, versus sometimes if you're the expert, you may conceptualize that the problem exists elsewhere and you'll be the one who's trying to create change or goals around making those shifts in the relationships so that there's improvement. You also need to think about what is change and what leads to change. And so sometimes people believe that if I have insight about a problem, if I understand why I'm doing something, then I'll change that behavior, right? If I understand that I'm drinking because I'm sad and I'm lonely, then once I know that, then I can say, oh, I just drink when I'm sad and lonely, and I'm not going to do that anymore. Well, sometimes that works. And other times people kind of believe in more behavioral changes. And so what that means is people don't change just because they know. Just because I know what the problem is, just because I know what the answer is, doesn't mean I change. Something has to change in terms of behavior. You also need to think about who is responsible for change. So are you as a therapist responsible to help the person change? Is the individual who's coming in for therapy responsible to change? Is the family responsible for change? So thinking about who's going to be responsible for that change. So some other additional philosophies are individual versus group change, right? Should change be focused on the individual changing, or does it require a bigger group to change? Freedom from something versus freedom for something, right? We have one that's kind of trying to get away from some kind of behavior, and freedom for is trying to maybe move towards that. Mind versus body, right? Are your problems being caused because you need to make changes in your mind, or is it because you need to make changes in your behavior, right? And this focus of, is it to be something or is it to become something, right? Is it about getting more in touch with who you actually are, or is it about you changing and becoming something different? So this can kind of help you think about the way that you think about clients and their problems and how they can resolve those issues. Some addiction philosophical dialectics. Early on, we talked about the moral versus the disease model. We've also talked about medication-assisted versus behavioral treatment. So there we're talking about if you were to have some kind of medication versus just focusing on treatment, that would be therapeutic or talk therapy or behavioral in nature. Abstinence versus moderation approaches. So that's where, you're not going to use any alcohol. Abstinence is really important versus just being able, the goal being to use moderately. So we see some of these different approaches. And so it's important for you to kind of identify where you fall along these continuums. Another thing to note is that therapy is both an art and a science. So there's several characteristics of addiction therapists that are pretty important. First is good mental health and personal adjustment, right? So you need to be in good mental health if you're going to help someone else become mentally healthy. Being optimistic about therapy and that you can be successful as a therapist, that you can really help someone, I think is really important. Organizational ability, it's important for you to be able to be organized. Maintaining appropriate boundaries. And this is really important, is that your therapy is client focused, right? That you're not kind of doing something in the relationship to meet your own needs. So sometimes therapists will share personal stories or anecdotes, but if you're sharing those, right, it should be because it will be important for the client or for the therapeutic relationship. Therapists need to be careful that they're not changing the relationship when they share something with a client, and also that they're not overstepping into some different type of relationship. Like if you're becoming too motherly or fatherly or friendly or maybe even romantic, right? That's going to be an inappropriate boundary, making sure it's professional and therapeutic. So also having positive experience or convictions about recovery is going to be really advantageous to any addiction therapist. Also being invested in personal and professional growth. It's my personal belief that if you aren't growing, then you're probably going the opposite direction, because people who are usually healthy are going to continue to grow in their health as they confront new problems and find opportunities to grow from adversity. They'll have appropriate ethics and values, and also use a sense of humor, right? It's important to be human as well when you're doing therapy. Nobody wants a robot to give them therapy, and so being able to be kind of genuine and have a sense of humor is important. Also, there are skills needed by the therapist. So therapists also need to be able to conceptualize addiction. It's really important that you are able to understand the problem in order to be able to really assist someone in growing and changing and entering into recovery, right? That's what our class is focused on, is the conceptualization of addiction in the family, right? Also, you would need to be able to examine effects of alcohol and other drugs in personal lives, prepared to deal with personal challenges around boundaries. So one thing that's interesting about being a therapist is, I guess it's a thought that I've had, is that it almost sometimes feels like long-term therapy for me, because I'm constantly being challenged, right, to be healthy, to maintain boundaries as I interact with clients. And so those things challenge you every day professionally, right? Especially when you're working with people who have come from families where there were not good boundaries, right? You're constantly being challenged to kind of reinforce the good boundaries that you've developed. And so in some ways it can feel like therapy for yourself, in terms of you have these experiences and you are learning how to do that consistently with different clients. It's also important that they view themselves as role models, right? We talked about being personally responsible for your own mental health and modeling that to clients. It'll be important to become familiar with the 12-step work. You may not be working directly in a treatment center, but a lot of your clients will be working some type of 12-step program, whether it's with you personally or in AA or some other kind of therapeutic setting. It's also important that they can conceptualize the meaning of powerlessness, right? Because that's one of the big principles of the 12 steps, right? Is that the importance of admitting you're powerless over the addiction and giving it up to your higher power. And then it's going to be important that the therapist is able to use these skills in conjunction with the therapeutic model that they are applying. It's also important for the therapist to know how their personal characteristics might impact therapy. So every therapist is going to have a different style, they have a different personality, and that's going to impact therapy differently. So a lot of times I use humor, and I like to have both very serious discussions, but I also like to have freedom in therapy, right, to crack a joke. I feel like for me that's something that helps me connect with clients on a more person-to-person level, although, right, not all therapists might do that. So it's important for me to be aware how that helps, and how that could also, depending on when I do it, right, I have to be strategic, because it could be off-putting to clients if I were to make a joke or do something that they felt was inappropriate or dismissive of whatever they were sharing or we were discussing at the time. So just be aware of how your personality characteristics could impact therapy. And then in a survey of substance abuse disorder clients, here were some important characteristics of therapists. We have positive traits, understanding, concerned, caring, experienced, honest, certified, good listeners, streetwise, easy to talk to, direct. So we kind of see, right, people like to feel that you care, you understand, you're qualified, you understand, like, right, streetwise, like you get it, and that you're direct and honest. So we kind of see some themes there. Negative trait, right? Asshole. Okay, well, self-explanatory. They have to like you, right? Feeling like you couldn't relate, dishonest, treat like children, right? So we see here two opposite ends of the spectrum, right? They want someone who's certified, but they don't want to be treated like a child. So they want an expert, but they also don't want someone who kind of rubs it in. I'm the expert. You're a child. You don't know what you're doing, right? So thinking about what that might look like to be an expert in a way that comes across as knowledgeable and understanding versus coming off as someone who is patronizing or demeaning to the client. Obviously, this has been people's experiences, right? That there's been some really great experiences and some really negative experiences. And so for that reason, anytime somebody asks me to recommend them a therapist or they want to go to therapy, I always say, if you don't like the first therapist, keep shopping, right? Don't assume that because therapy didn't work with that person, that therapy's bad, right? Sometimes therapists, sneak through and graduate and they're not great therapists, and that's unfortunate. But I think it's important that clients know that just because one therapist wasn't a good therapist doesn't mean that therapy can't be useful for them, because I think if they get a therapist that they can really bond with, that really cares about them and is knowledgeable, they can really have a big impact. So the therapist relationship with addiction. So something to think about is, do you have to experience something to be able to help someone with it? This was something that we talked about a lot when I was getting my master's degree, because a lot of people getting master's degree are not married, they don't have children, so how are they supposed to talk about marriage if they're not married? How are they supposed to help parents who have a difficult teen, right? They haven't had these experiences. So it's my personal belief that you do not have to experience something to be able to help them with it. When you're a therapist, you're trained to conceptualize problems, and that's unusual, right? And even if you are a therapist, sometimes therapy could even still be helpful for you, because it's difficult to see your problems from inside your family or your couple unit the same way someone could see it from outside. So I don't believe that you have to experience something, but it's important to know that SUD clients, more than any other clients, really have an expectation that you have experienced addiction and recovery. And so they'll often ask if you're in recovery yourself. And so that's something that you need to be thoughtful about, is how are you going to share your experience with addiction and recovery with your clients? And so it's important that if you're going to self-disclose about that, that it's focused on enhancing the therapeutic relationship and not detracting from it. Right? Sharing too many details might not be helpful. Sharing that you are in recovery might be very helpful, but sharing a lot of details, right, may also impose like beliefs on your client, that your client thinks, oh, I should do just what my therapist does. And then if that doesn't work out, right, the client might feel like more of a failure because they're not following what the therapist did exactly. The importance of empathy goes really far, right? Empathy is when you're able to connect with what another person is feeling, whether or not you experienced it. And so that requires you to go to a place where you identify with pain and you connect to that person. Your personal experience can really be helpful in understanding what another person is going through, but it can also lead to misunderstandings. So my first husband died in a car accident, and one thing that I found is that it can be very helpful that I've experienced the sudden death of a close one, because now I understand the pain of losing someone who's very close to you. However, that experience was my experience, right? I had a certain relationship. I lost my husband at a certain time in my life. And that is the struggles that I have had with that are going to be different than my client's struggles with a death that they might have in their family or in their life. And so it's important to kind of be mindful of the limits of your experience, right? Use your experience to enhance your understanding, but be aware that it can give you tunnel vision, and you can assume that other people experience it the same way you do. And the truth is, some things you will share in common and other things will be different. So some risks about disclosing, particularly about addiction, right, might be that the client could worry that the therapist is relapsing, or that could happen. So be aware of that. And the client may also feel, right, I kind of discussed already, that the therapist path has to be their path. And then there's also the worry that the client may reject the therapist path. So if you are a therapist and AA has been a big part of your recovery, but your client doesn't like AA, how is that going to affect treatment? Are you going to be offended by the fact that they don't believe in kind of group therapy, or uncomfortable with that? So being mindful that if you share about your recovery process, that might pose some risks. So equipotentiality means that we're all starting from the same place, and equifinality means that we're all ending at the same place. And so being aware of how that relates to therapy. Do you believe that your clients are all starting from the same place? Or do you believe that all clients need to end at the same place? So the way that I think about this is that I may have two different clients that have a substance use disorder, right? And they start off at the same place, but maybe their results are different. One person learns to moderately drink and one person learns to be abstinent, versus feeling like maybe people are at a different level of drinking issues and the goal might be, right, to all be abstinent. So kind of thinking about how that might relate to how you view or conceptualize your clients is important. Is there a certain point that you think they should all get to, or are you more open to there being multiple solutions for the same problem. So if you are someone who is in recovery, it's important to think about what that means for you in your recovery. So if you are attending meetings, it's important to hold boundaries regarding professional relationships. So it may be important if you find that one of your clients goes to the same meetings as you, you might need to find a different meeting, or you might want to develop a therapist-only meeting. That might be helpful, especially if you're in a small town like Lubbock. That could be helpful. Also, some therapist concerns is, is this triggering for you? If you are somebody who's in recovery and then you have a client who talks a lot about drug use and that's your drug of choice, maybe that becomes very triggering for you, and it is not helpful for your own recovery to be working with this population. I used to work with children who were sexually abused, and although I was not sexually abused as a child, I found that working with them extensively was very triggering. It was very stressful. And in fact, one time we had a training on secondary PTSD, that could occur. So after I finished my internship, I decided to go into private practice because you get more variety of problems there versus focusing solely in a career where I would exclusively work with children that had been sexually abused. It felt so heavy. So that's something to think about, whether or not you want to have a variety of clients and that would be helpful to you, or if there's a particular population that is too stressful for you to work with. And then also be thinking about therapist therapy, meaning that, right, sometimes therapists themselves might need therapy and to develop certain skills, right, to be able to handle the emotional load that you take with being a therapist. I know that, like, for myself, therapy isn't something that I always do, but after my husband passed away, I made a conscious decision to go to therapy. And being a therapist, you're surrounded by great friends who are therapists. So often it feels like you have a lot of resources that you wouldn't need therapy. But that was a choice that I made because I knew that I was dealing with a lot, and I knew that it would be important for me to set aside time, and also be able to talk to somebody who was unbiased. I think a lot of times when you're going through something, friends sometimes want to be really positive, and so sometimes it can be nice to interact with somebody who will maybe give it to you a little more straight, or won't sugarcoat things, and kind of just has a different perspective, right? Almost like a bird's eye perspective, because they don't have a personal relationship with you. And I found that it was very helpful, and helpful in a different way than it was just to even talk with friends that were therapists. So it's something to think about or be open to, right? Is that at any point you may want to go to therapy in order to address some of your personal issues, or just, as a space to process some of the things that you're dealing with as you grow personally and professionally. So that's the end of this lecture. I hope you now better understand what it means to be an addiction therapist and what that means for you personally in your personal journey.